Hi, my name is Steve Bernstetter, and I'm the Director of Health Policy and Compliance in the BJC Corporate Compliance Department. Today I'm going to tell you a little bit about the health insurance marketplace. So, what is the marketplace? Well, the marketplace is part of the Patient Protection and Affordable Care Act, or the PPACA or the ACA, sometimes called Obamacare, but mainly just the new health reform law. The marketplace is a program operated by some combination of the federal and state governments. So, for example, in the state of Illinois, the state government has partnered with the federal government to bring you a unique Illinois-specific marketplace experience. In the state of Missouri, it's purely run by the federal government, and different states have different arrangements. The marketplace is mainly a new way for legal residents of the United States to get affordable health insurance coverage that they might not have been able to get otherwise. And also, in some cases, to get financial support for these health insurance policies. And lastly, the marketplace is an opportunity for BJC to help its patients get insurance coverage and pay for the cost of their health care. So, a little bit about it. I mentioned earlier that part of this includes some financial assistance. So this little chart here lays out something called the federal poverty level. This is an amount of income calculated each year by the Federal Department of Health and Human Services, and it governs a lot of eligibility for different federal programs, such as food stamps, some Social Security payments, things like that, and now the marketplace as well. So if you're a family of four and you make an income between about $24,000 and about $97,000 a year, you could be eligible for some financial assistance to buy one of these health insurance marketplace policies. For a family of four earning between about $25,000 and about $61,000, you might also be eligible for some help paying your out-of-pocket costs associated with that coverage. So, how does the marketplace work? Once a year, we have an open enrollment period. In plan year 2016, that period runs November 1st of 2015 through January 31st of 2016. And basically, any resident of the United States during this time can go on to the marketplace, enter in some information, and it will tell you whether or not you qualify for coverage. So, after this open enrollment period ends on January 31st, special enrollment periods will be available after that. So, for example, if you lose your job and lose your health insurance coverage, then you'll be able to go on the marketplace and get a special enrollment period to try and sign up. If you don't qualify for a special enrollment period and you don't sign up during open enrollment, you're out of luck until the next open enrollment period sometime next year. So people who are new to the marketplace will be required to submit some personal info, some income information, information about their employment, and whether or not they have access to any other type of insurance coverage. This is the third year for the marketplace, so some people will be returning. For returning enrollees, you may resubmit all of this info again, or you may auto-re-enroll using your previous year's information. For those who do need to re-enroll, we would recommend that you do resubmit all of this info. There's some complicated interactions between your taxes and things like that that could determine your coverage and whether or not you're eligible. And lastly, the marketplace is a website. So it's www.healthcare.gov, or there's a hotline, 1-800-318-2596. And if you're working through the website, you enter this information into the various screens, and it gives you an answer, what you're eligible for, whether or not you can get financial support, and sort of what plans are available in your area. So what are the results so far? As I mentioned, this is the third year. During the 2015 open enrollment period, a little under 12 million Americans signed up for a marketplace plan. In Missouri, that's about 250,000 people. In the St. Louis metro area, about 110,000. And not quite 120,000 in the BJC service areas in Missouri and Illinois. So that includes, of course, St. Louis, as well as Boone, Parkland down in Farmington, Sullivan, and sort of surrounding counties. For this year, we're expecting about the same amount of enrollees to return, hopefully 1 or 2 million extra. So the purpose of the marketplace is essentially to decrease the number of uninsured Americans. So each year we're hoping to see more and more people sign up for this, and therefore that there will be fewer people lacking insurance. So what is BJC doing about it? We're preparing to help our patients explore the marketplace, see if they're eligible, see if they can get financial assistance, and if so, hopefully enroll in a plan, especially a plan that includes BJC hospitals, doctors, clinics in the provider network. So some of the things we're doing, we're training certified application counselors, or CACs, or CACs, who are experts on marketplace enrollment. They go through a pretty rigorous training and certification process organized by the federal governments and the states to sort of teach them how this program works and how to help patients and the general public access the marketplace. We're also setting up a call center to enable patients and the general public to schedule counseling sessions with these counselors at BJC hospitals. So each hospital has at least one of these counselors available to take appointments during the week. And appointments typically last 1 to 3 hours, depending on how complicated your situation is. And we're also partnering with other agencies throughout the St. Louis area and the state who are doing similar sorts of work. So the umbrella organization is called Cover Missouri Coalition, and they include social service agencies, nonprofit organizations, and other healthcare providers across the state and in St. Louis. And BJC is also preparing a marketing and outreach campaign to encourage our patients, especially those who are currently uninsured, as well as the general public, to meet with one of our counselors and consider a marketplace plan. So the first thing you can do is go to www.bjc.org/marketplace, where we have all sorts of resources about sort of what the marketplace is, who qualifies, how the financial assistance works, and also a phone number that you can use to call the call center and set up an appointment with one of our counselors at the BJC hospital of your choice. You can follow BJC on social media, so Facebook, Twitter, all of those sorts of sites. We'll be doing some outreach through those. Look and listen for BJC television and radio commercials that mention the marketplace. These will start sometime in November and run throughout the open enrollment period, which concludes on January 31st. And we'll also be doing a targeted direct mail campaign focusing on our currently uninsured patients, as well as those patients that were previously enrolled in the marketplace, but maybe need to re-enroll or maybe want to change plans from a non-BJC participating plan to a BJC participating plan. So the goal again is to help our uninsured patients and really the general public, whether you're a BJC patient or not, access affordable, comprehensive health insurance through this marketplace. It's an important part of the healthcare reform law, and we are here to help you navigate it. So any questions, please check out the website, or you can also contact me. I'm available through BJC GroupWise and also through some other sources. So thank you and good luck.